Okay. So your handwriting should be a little clearer. White chapel, C is looking small and road is R. So handwriting should be clearer. Okay, little clear. Clarity is needed. Clarity is needed. So road, R-O-A-D, you have to write here. R-O-A-D, better. Write full form, R-O-A-D. Okay. So R-O-A-D is better to write in full form. Street and road, that is, if you know, you have to better write that one. Okay. Greater London, okay, United Kingdom, this is not clear. K is not clear. So 18th April date is missing, dear Dr. Emerson. So that should come first, and Nicole Katie regarding subject should come afterwards. I'm writing this referral, all these things. Don't write in active voice. So write in passive voice. Is being referred for the evaluation and a definitive diagnosis. So just start with Mrs. Nicole Katie, comma, who presented with the symptoms suggestive of peptic ulcer disease, is being referred for further evaluation and a definitive diagnosis. So initially on 15th April, Mrs. Katie initially presented with indigestion, severe abdominal pain radiating to the back and lower abdomen. Okay, right. The pain is aggravated by food consumption. See, it's not clear. Food consumption and food consumption only, and associated with the loss of appetite. She reported significant loss of weight. So she reported, remove this one, and says significant loss of weight was reported and change in the color of urine were reported. So here, both together here, you can say were reported. Passive voice. Were reported. Full stop. Instead of she reported, you can say were reported in the end. Prescription of analgesics was made. Analgesics were prescribed. Analgesics were prescribed. Analgesics were prescribed. So analgesics were prescribed. Okay. Okay. Right. Analgesics were prescribed. Was made. No. Analgesics were prescribed. You can say analgesics were prescribed. Analgesics which were prescribed worsened the condition. Like that you can say. Analgesics, comma, which were prescribed, comma, worsened the condition. Worsened the condition. Worsened the condition. Worsened condition. Like that you have to write. Worsened condition. So next, 3 days later, Mrs. Nicole presented with worsening symptoms. She complained of severe abdominal pain was reported. You can write, instead of she complained, you remove this one, but severe complaints of remove. She complained of remove. Severe abdominal pain was reported for several hours. That what is this? Asked, lasted. Severe abdominal pain that lasted for several hours was reported. Okay, this was associated with vomiting, fever, and sweat. Not sweats, sweat, that's all. In addition, blood was noticed in urine and feces spelling. Okay, and she has bouts of shortness of breath. Shortness of breath. Bouts of shortness of breath were mentioned, reported. Medical history revealed. The medical history revealed a severe attack of tuberculosis in 1983, or you can say she has a history of severe of tuberculosis. She has a history of tuberculosis. Brackets 1983, appendicitis in bracket 1987, depression in 1992, and uterine infection in 1997. You can write all of these things. She has a history of tuberculosis, appendicitis, depression, and uterine injection in 1983, 87, 92, and 97 respectively. You can write like that. Okay, Aisha? Is that clear?
Yes.
Okay, she has a history of tuberculosis, appendicitis, depression, and uterine infection in 1983, 1987, 1992, and 1997 respectively. Like that you have to write, okay?
Okay.
All the years you can put afterwards and say respectively, one after another. Okay, next one. A suggestion of abdominal CT scan was made for appropriate diagnosis. Okay, CT scan was sought for appropriate diagnosis or was suggested for appropriate diagnosis. I would like you to look into Mrs. Nicole's case and evaluate further. Evaluate further. I would like you to look into Mrs. Nicole's case and evaluate further. So you can write here, write down, based on the aforementioned circumstances, evaluating Mr. Nicole's case, and coming out with a definitive diagnosis would be extremely beneficial. So in case you require any additional information, please, okay, like that you can write. Okay. So you can, and don't write the name if it is not given. Dr. Asila, no, don't write the name if the name is not given. Okay. Here you can write. So based on the aforementioned circumstances, further examination and definitive diagnosis would be profoundly beneficial. Like that you can write. If any additional information is required, please do not hesitate to contact me. So you can write like that. In case any additional information is required, that is what it is. So you can write like that. Okay. Here you can say, based on the aforementioned circumstances, like that, and continue the matter. Is that clear? Okay, Dr. Aisha, is that clear?
Yes, sir, but I don't understand. Kindly do not hesitate to contact me.
Kindly do not hesitate to contact. In case any additional information is required, kindly do not hesitate to contact me. That is means please contact me is more polite. Kindly do not hesitate.
Yes, I know, but I don't. I feel like the sentence is not right because kindly. I think do not. I think I should use another word.
So please do not hesitate. You use otherwise. Kindly or please are one and the same. Now do you feel okay?
Yes.
Kindly or please, both are the same. That doesn't make any difference. Okay, no worries. Whichever you are comfortable, that is better. Okay.
Okay.
So this is also fine. That is also fine. No worries. Kindly can be substituted. Kindly means please. Please means kindly. Kindly do the work or please do the work. Both are the same. Okay. Right. Okay, fine. I'll get back to you in the night.